Right. So I think we will kickstart this meeting. So I'm very excited to be introducing this event today. So this is the Young Adults Digital Health Charter, and this is part of the South Yorkshire Digital Health Hub project that I'm part of. So my name is Marjorie. I'm an associate professor in ethical artificial intelligence at Sheffield Hallam University, and I'm going to be introducing the event today. So I hope you're all geared on to this amazing outcome and this amazing topic. Right. We have an agenda, and as I said, this is part of the South Yorkshire Digital Health Hub, which is a project that engages a lot with communities and patients. And the agenda for today is that we have a welcome, which is what we are now. We have a policy context and research overview for the project, the key principles that were the results of the charter, and then a panel discussion with very exciting and important people. And hopefully make sure that you keep your questions in the Q&A option for the teams. We are going to have some time at the end to answer those questions. If you are super excited about this and you want to read the full charter, please make sure that you access the link in the slides. The material will be available. It's available now for you to read through the whole report. So I'd like to introduce the first speaker for today, which is Esther. She's from the Association for Young People's Health, and she's going to talk about policy context.
Thank you very much. And it's great to be here, actually. We've been involved in this project sort of from quite early stages, and our purpose as a charity from the Association for Young People's Health is really to promote the particular health needs of young people through their sort of adolescent period and into adulthood. And this project is really interesting from that perspective. I think the Ofcom stats say that about 99% of young people aged 16 to 24 actually are online and have access to a device to which to access sort of, digital health. And I think that leads to a lot of assumptions actually about young people in this age range and how they may use digital health and how they may access it. And one of the things we're particularly interested in is the health inequalities that are present within this age range. And what we find is that whilst most young people do have access to a device and are online, there are a lot of assumptions made about their sort of online usage, which don't always take into account some of the really crucial things when it comes to accessing healthcare, like having a private space from which to actually take calls or to attend sort of online appointments, being able to access affordable data, having a device which is stable and reliable. And I think some of the young people that we work with who are the most vulnerable, we really see those things present. Numbers change all the time. It's tricky for them to keep up with passwords, with accounts, to know how to download some of the tech that is required for accessing online digital health. So it's really pertinent, actually, because that all comes in the face of a couple of key things. One is the policy context, which we're currently sort of looking at the NHS 10-year plan, which has a really strong move towards sort of digital first. And that particularly looks at sort of digital front doors, having virtual consultations, online triage, remote monitoring of people's health, and looking at sort of accessing your personalised health records online. And so for young people who may not find it so easy to access online tech, this can actually look at ways where health inequalities are further exacerbated. And that's something that's been highlighted, particularly through the House of Lords. They've got a Comms and Digital Committee, which has highlighted a number of times the potential impact of digital exclusion. However, on health inequalities, it does create digital first does create huge opportunities as well. So I think we're particularly keen to look at how we can ensure that young people in this age range have a voice in policy, have a voice in shaping how this tech is sort of rolled out. And that's one of the things I think this charter and the process has been really brilliant for, because it has highlighted this age group in particular and the different features that young adults are particularly faced with in terms of their health as well as their access to tech. So this is a really crucial age and stage. It's a period of time, this sort of 16 to 24-year-old age group where young people have to navigate from accessing paediatric or children's health services into adult health services. It's a time of great transition in terms of their own social lives, whether they're sort of moving out of home, gaining further independence, moving from education into the workforce. And a lot of these issues have been raised by young people as creating particular needs in terms of their health, but also particular anxieties around how they access health services. And these are some of the discussions that really emerged through this work as well. So I think, I mean, they're the key things that I really wanted to highlight, actually. It's just that this is a time of great opportunity in terms of policy, with the NHS 10-year plan. It feeds into opportunities to influence some of the planning that's going on sort of with integrated care boards and sort of looking at the sort of national policy sort of pushes towards more digital healthcare. And it's a great time to really explore how young people in this age range, what they need from this tech and how their voice can be involved more. That's, I think, all I've got to say. If I can hand back over.
Amazing. Esther, I'll actually take it from here to introduce the next section. Thank you so much for that. So to introduce myself, hello everyone, my name is Dr. Kirsten Hay. I'm a research fellow in public and community involvement innovation within digital health at the South Yorkshire Digital Health Hub. And I'm going to get going on this section before passing over to Angela, one of the young facilitators at AYPH. So to start off, I'm going to give a little bit of a background to this research work. So at the South Yorkshire Digital Health Hub, we've been conducting deliberative exercises with Hopkins Van Mil as part of our work at the Hub involving public patients and communities at the earliest possible stages of digital health innovation. Our first work in the space set the aims, priorities, and objectives of the Hub with adults. And for our second, we really wanted to contribute towards the ongoing work within South Yorkshire around innovation in children and young people's healthcare. Young adults are a distinct category, as at 18 years old, they're often grouped into a general adult population, despite some reporting worse healthcare experiences than other age groups, both older and younger. So before we got started on this work, we spoke with academics, health and social service providers, third sector organizations, and young adults living with long-term health conditions to sort of plan our approach to this space and this work. So these conversations really highlighted a desire for young adults to be understood as people, not patients, in using digital health technologies. So a more holistic understanding really being needed to reflect the complex factors that would affect how digital health was being used or not being used by young adults within their everyday lives. And this especially the case when also managing a long-term health condition. So with this in mind, we worked with Hopkins Van Mil, AYPH, and Chilypep to design and deliver a series of workshops with young adults to create guidance on what's important to understand about the design and use of digital health technologies, which resulted in this Young Adults Digital Health Charter. So at this point, I'm now going to hand over to Angela, who is a fantastic young facilitator at the Association for Young People's Health, or AYPH, who worked with us to deliver this. And she'll be able to give more details about the research design and to share her reflections on being involved in this Young Adults Digital Health Charter as a facilitator. Angela, can I pass it over to you?
Yes. Hi. So I'm Angela. Like Kirsten mentioned, so I'm a young trainer with AYPH, and I've been sort of involved in a range of participation projects around healthcare, and it's something I'm sort of motivated to do because I've kind of seen firsthand kind of the importance of having young people's voices in the design of sort of healthcare and health innovations, and I think that's something that really interested me about this project is kind of how it centered kind of the voices of sort of the young adults, young people. So I helped to facilitate the 3 online workshops and then the 1 whole day in person workshop. And I think something that really stood out to me was the something that sort of the young people in those workshops highlighted was kind of the importance of accessibility and kind of see the digital health tech kind of being sort of suited to their individual needs and able to sort of being accessible to them and being able to be tailored to their individual needs, which is something I found sort of came out a lot in the workshops, and it was interesting to be involved with.
Amazing. Thank you very much, Angela. It was fantastic to have you involved in these as well, as we led from this sort of series of planning with topic experts, going through the workshops, as well as then drafting the charter review itself, and then finally the launch of the charter. From this point, we may then just launch into the charter itself, which I can take us to our next slide. So within this, in this section, we're going to be presenting the Young Adults Digital Health Charter. And to keep to time, this is going to be a fairly whistle-stop tour. However, the full charter, a 2-page briefing, infographic, and video summary will all be available on the Hub's website later on today. On this page, we have a summary of the 10 principles in the Young Adults Digital Health Charter. So again, this is a lot of information and it's a fairly whistle-stop tour. So I'll be going through each of them individually. However, it's important to note that these shouldn't necessarily be approached as solutions, but principles to shape how we create the future of digital health together. So as a group, I'm going to just launch into things and start with principle 1. So principle 1 is recognize us as a distinct group with unique and changing digital health needs. So our participants held a diverse range of roles within their everyday lives, reflected in different digital health needs. However, they commonly experienced rapid changes within both their lives and identities as young adults. In response, they wanted digital health to be able to accommodate these changes and be adaptable to their needs over time. Additionally, we know young adults are underrepresented and underreached as a demographic, and this was felt by the young adults who took part. They spoke of wanting to be a part of change, however, really feeling a sense of disengagement as their concerns felt unasked for or unheard often, especially during recent large-scale events like COVID and Brexit, and this having had a major impact on their lives. So our second principle is support us as digital learners, not digital natives. Participants spoke about the expectation of them to be tech savvy, and this often leading to a sense of responsibility or actual responsibility to be the designated teacher in a room. For some, this resulted in informal or formal care responsibilities within their families and communities, such as helping older adults navigate digital health technologies, while themselves really feeling unprepared and untrained to use these tools and services, as they would also often be teaching themselves how to use them. In response to this, young adults called for clear, accessible education and training on how to use digital health tools for themselves and others, and for digital health tools to be designed to suit different learning styles and be adaptable to individual preferences. The third principle was ensuring digital health tracking supports us as we develop as young adults. So during the sessions, participants spoke of how they first started interacting with digital health tracking apps at young ages, many around 10 to 12 years old, and they witnessed or even experienced themselves negative or obsessive behaviors around health tracking, especially things like food and fitness. This is a generation that has grown up with tracking apps and received very little guidance on how to navigate this, while social comparison at the same time has grown exponentially through social media. In response to this, young adults want better support for health tracking, including education on how tracking can be used in healthy ways, support to understand what can be tracked and why, and options to choose and limit what is tracked and shared, including being able to turn off social elements of digital health tools and set healthy digital limits. The fourth principle was about enabling digital health support to move with us. So in addition to these rapid life changes going on for young adults, participants also spoke about the geographic changes that were taking part at this point in their lives. So this could include moving to new places for work, school, training, or just around living independently or navigating life changes at that point in their lives. However, while young adults were often moving, their data and digital health services would be much harder to relocate often. The disconnection of health data throughout the UK is well known, with the need for interconnected health data systems ranging from between units in a single hospital, between regions in a county, and throughout the wider country. This also, you know already likely, being a key aspect of the NHS's new 10-year plan. In this charter, young adults highlight the impact of this issue in their lives, especially when managing long-term health conditions. So those moving away from home or between locations need to navigate the bureaucracy of a new system, which may or may not commission or even support the previously used digital health tools and services that they might know and be accustomed to and enjoy. In response, young adults call for more efficient and accessible ways for their health data to be accessed between regions, regional providers, and within local networks to avoid re-explaining their health and ensure a consistent quality of care. Principle 5 is ensuring affordability for digital health for young adults. So young adults can't always access the latest models of phones or afford premium subscription. This limits accessibility to digital health tools and services, especially for young adults emerging during a cost of living crisis. Some young adults that we spoke to shared experiences of navigating the financial costs of managing their health independently while on a very limited budget. This included purchasing top-of-the-line smartphones to try and extend how long their phone's operating system would be supported to be able to work with devices like hearing aids, or the catch-22 of not being able to afford the things needed to prevent full health, then impacting their ability to work and thereby affording them ongoing. Young adults need digital health to be affordable and want digital health to be prioritized as an enabler for healthcare rather than just treating them as customers. Principle 6 is integrating digital health consistently and appropriately with in-person NHS and care services. So during the workshops, participants reflected on frustrating experiences of inconsistencies between what is done in person and online within their healthcare. This included service inconsistencies in things like where to go and how to book appointments, as well as feeling left in the dark when tools were changed or updated without notice or support. There was also a desire voiced for in-person options to be available at key points, especially through often digital pathways, such as receiving test results, interpreting symptoms, or health diagnoses that could cause undue stress when navigating alone. These combined factors illuminate a need for consistent and clear healthcare routes involving digital health, especially as digital health continues to be integrated into digital health systems and services. This is especially crucial in the context of young adults, given considerations for how this consistency may also then be impacted by navigating a new healthcare system when moving, or as a young adult is navigating the management of their health or others. Principle 7 is another key principle related to healthcare service delivery, as support and train healthcare professionals to use digital health tools with us. So in addition to their own needs, the young adults flagged the importance of health professionals to be supported to use digital health tools and services. This included supporting professionals to utilize digital health effectively with young adults, for them to be trained to help young adults navigate and engage with digital tools effectively, and to enable young adults to track and understand their family health histories and their own health risks to make informed decisions about health using digital health technologies. Principle 8 then after this is help us navigate trustworthy digital health sources. With so many digital health tools available, the young adults spoke of feeling overwhelmed by knowing what to use and who to trust in relation to digital health, excuse me. This included health information that was digitally mediated through online platforms, particularly platforms like TikTok. While the pros and cons of social media for health were, especially for health awareness, were discussed, the young adults felt that there was a lot more that could be done by digital health providers to be present and active on digital platforms that they were accessing health information on as known platforms. In response, young adults called for the wider digital health sector, including healthcare providers and digital health companies, to take responsibility for challenging online health information and inaccuracies. Principle 9 extends on this theme of navigating trust online by asking to improve transparency and trust in who is involved in digital health companies. In this principle, young adults described a desire to be included as co-designers of digital health, providing regular feedback to support digital health to evolve with their changing needs over time, as well as a desire for greater transparency in how digital health tools are developed and used to ensure ethical and acceptable practices throughout. They highlighted that including trusted nonprofits within the development of digital health would help build trust that the tools and services being made championed their needs, were designed appropriately, and would focus on health over commercial interests. And finally, I know it's been a lot of information, apologies again. Principle 10, explain what's happening with our digital health data in ways that we will actually engage with. Building on the topic of transparency, young adults voiced wanting to be educated on data security and protection so they could understand and make choices about digital health. Specifically, they want communication to be clear, concise, and actually usable. No pages of terms and conditions that no one will read, provided in accessible formats, and for the consent options for data sharing to be easy to understand and be able to change over time within the systems. So this concludes the overview of the 10 principles of the Young Adults Digital Health Charter. This has been a lot of information in a short amount of time, and you may find some principles more relevant to your area of work or expertise than others, given the variety of stakeholders involved in digital health. So at this point, I'm going to pass over to Professor George P. at the South Yorkshire Digital Health Hub, who will introduce and facilitate our panel discussion, exploring responses to the Charter from some of these key areas.
Thanks very much, Kirsten. We promised it was a whistle-stop tour. There's a lot of information in there, and I hope you'll agree that some of the quotes that are shown there are incredibly powerful. Now, of course, for a charter to be really worthwhile, it needs to go beyond listening and actually influencing what happens next. So I'm delighted to welcome a panel of 5 experts representing different sectors and interests in young adults' health and digital technologies. We have Dr. Liam Foster, who's a senior clinical specialist at Google, who works on improving the quality of health information across products like Search, YouTube and Play. We've got Bethan Plant, who's a public health specialist working at Sheffield City Council, who's responsible for the children and young people's public health team. Dr. Samina Khalid, who's a consultant in young adult rheumatology and is the rheumatology transition lead within her trust. Professor Paul Dimitri, who's Professor of Child Health and a consultant in pediatric endocrinology and a national leader in child health technology, who also directs the NIHR Health Tech Research Centre in Pediatrics and Child Health. And Chantel Park, who's a Youth Participation Programme Manager at Chilypep, where she's been working in youth participation for over 15 years now. And I'm going to put each of these experts on the spot for 3 or 4 minutes and just ask their reflections on principles in the Charter and maybe where we go from here. So I'm going to start with Liam. So Liam, I wondered if you could give us some reflections just on what you've heard and this general area.
Absolutely. Yeah. Hi, everyone. Great to be here. So quick intro. My name is Dr. Liam Foster. As you've just heard, I work at Google. So day to day, I'm in teams that are actually building digital health solutions. So that's solutions that are sometimes targeting real people. So kind of consumer products, things like Fitbit, for example, some of you might have used. But I also work a lot on enterprise solutions that are building things for health organizations. And that tends to have a big focus on healthcare data and how data is stored and used. So this charter, I feel, is incredibly relevant to me and to my team and to many of the other kind of multidisciplinary roles that I work with across designers, user experience specialists, and even things like our communications department about how we describe our products and how we educate people on how to use our products. I think it has implications for a whole bunch of people across our team. So I will definitely be sharing it, and I look forward to reading the full report. I guess in terms of my reflections, I've got a lot, and maybe if time allows, feel free to come back to me because I could probably talk for quite some time. But I guess I've got the privilege of going first, so I'll just start at the top really with what I see as like foundational to everything here is emphasized in the first couple of principles. The need to kind of really identify and recognize the unique life period that ages 18 to 25 represents, and the fact that those, there's a lot of unique needs. The needs themselves are changing dramatically in that period, and therefore we really need to put a lot of conscious effort into kind of co-designing with members of that age bracket to try and make sure we understand those problems and design solutions with them in mind. And I think as a technology company, in my experience, I work a lot with startups as well as I work at a big company. And when we talk about age brackets for possible customers and user groups, market segmentation in the business lingo, adults tend to get lumped together in big age brackets. You see children get divided up into more narrow age ranges. But I do think we could do a better job of really honing in on that young adult population and really encouraging collaboration and co-design. And there's lots of opportunity there. I think we can try and take action on. I'm thinking about user experience research initiatives that we run or product testing that we perform. Even things like feedback sessions and being at the privilege of a larger company, we often have things like advisory panels that give kind of input into our product roadmaps and things. And I think this charter is a really useful resource to really kind of reinforce and champion the need for young people to be represented as a distinct group there. So that to me is a kind of foundational point that's echoed in Principle 1 and certainly something to take on board. I think as a tech company, there's a whole bunch of stuff towards the latter principles around trust, whether it's navigating trustworthy sources or the trust inherent in having people's health data, which is obviously super sensitive. And I think all companies can do a huge amount to build trust, and health is dependent on that trust. So I could definitely talk more about that. But perhaps I know we've only got a couple of minutes each, so I'll hand back to George to move on.
Thanks very much, Liam. I think it's great to hear that sort of attentiveness towards the distinctive sort of life phase that we're talking about here, and of course some of the discussions about trustworthiness and trust in data and digital health technologies isn't unique actually to this age group. I think we encounter these across the board, but perhaps there is a slightly distinctive flavour to that among the young adults that we listen to. I wondered now if I could pass to Professor Paul Dimitri. So Paul, your reflections on the Charter and maybe where we go from here.
Thanks very much, George, and good afternoon, ladies and gentlemen. It's a pleasure to be here. Thanks, firstly, for inviting me to reflect on what's a hugely important and timely piece of work. And what I've done is reflect on the Charter and what it means to me based upon the 10 principles. And as we continue to shape the future of adolescent and young people's health and healthcare through the technology that we develop, it calls on us to ask ourselves, who are we designing for? And more importantly, how are we designing with them? And the new 10 principles of the digital innovation for young adults really offer a powerful answer to that. They're not just a framework, they're a declaration from young people themselves, reminding us that digital health must be built around their realities and not our assumptions. Charter really calls upon us to recognise young adults as a distinct group and with unique and evolving needs. And it demonstrates that their health journeys are dynamic. They're shaped by transitions, identities and environments. And our technologies must reflect that complexity and not flatten it or dismiss it as not being important. It also challenges the myths of this idea of a digital native, and young people are digital learners. They navigate a landscape that's often opaque, overwhelming, and relatively inconsistent. So we've got to design tools that teach, guide, and empower, not just assume fluency where it may not exist. When we look at the 3rd and 4th principles, it speaks to continuity. Digital health has to track development, not just symptoms, and it has to move with young people across their colleges and universities, through their homes, clinics and life stages. Static systems don't serve dynamic lives, so we have to make sure that we are dynamic in what we do. When we look at Principle 5, this reminds us about affordability to access. So if digital tools are priced out of reach, they become instruments of exclusion, and we must build models that are sustainable, scalable and equitable to meet the needs of all young people and not just a select few. The Charter also calls for integration. It shouldn't replace in-person care, it should enhance it. And young people deserve seamless and coordinated support where digital tools are a part of a trusted relationship, not just a substitute for one. And it also turns a lens on us as healthcare professionals. We must be trained and supported to use these digital tools with young people, not just for them. And it's really about a partnership. This is not a prescription. When we move to the latter principles, it speaks to trust. Young people need help navigating credible sources, and they deserve transparency about who are behind the technologies they use. And trust is earned through clarity and not branding. When we look at today's saturated digital landscape, young adults are bombarded with health information, some of it which is credible, but much of it which isn't. And these principles really call for a deliberate shift from passive access to active guidance. It's not really enough for us to build tools. We must ensure trust is central to all that we develop. And then finally, we look at the last principle. It asks us to explain data use in ways that engage. So not using legal language or buried in terms and conditions, but language in a way that respects young people's intelligence, their curiosity and their right to know. And it's only by doing this that young people will really engage and ultimately remain engaged. And these principles that have been set out, they're not optional, they're essential. And the Charter demonstrates that digital health with young people is about relationships, it's about rights, and it's about respecting the voices of young people as central to everything we build. So really we have a duty now, we have a duty to honour these principles, not just in our rhetoric, but in our systems, our funding, our governance, and in our future developments. So I'll leave it there, and thanks very much for inviting me to comment.
Thank you very much, Paul. A very, very powerful overview of those principles. And yeah, I'm particularly struck by your use of language of deserving, actually, some of this stuff, as well as the phrase of trust is earned, actually, within this. So I think really useful overview, actually, of all 10 principles and the Charter as a whole. I wondered if I could turn now to Samina Khalid. So Dr. Khalid, as a consultant in young adult rheumatology, very familiar with working alongside young adults with a range of health problems, and also the sort of challenges and transitions in healthcare. So Samina.
Thank you very much for inviting me. So this is particularly important within my age group. I deal with 16 to 25 years old, and I agree they're going through a period of transition, a period of change. I think the way this digital charter resonates is when I look at my patients, not only have they got lots of commitments from university, education, work. They may be under myself, but they may be under multiple medical teams. So trying to get their life organized is very difficult. I think it's quite important to integrate digital health with in-person services and trying to manage and make things more meaningful for the young person. I do want to just use an example. So I had a young person recently who found themselves unexpectedly pregnant on a medication that I had prescribed. And they spent a whole weekend trying to figure out if they could continue with their medication or not realizing that actually we discussed this exact same issue at the last clinic appointment, but they were not sure where to find the information, where to turn to. So they spent a whole weekend being fretful and anxious. So because they did not know where the information was kept. I think a way to organize this information is very helpful so they can better manage their lives, and there are several commitments. Within rheumatology as well, we do a lot of outcome measures. So we do a lot of things like quality of life and scores. We do pain scores. We use them to assess disease severity. And I think if we can use them together, so learning together with the young person how best to use them, but not only allow the young person to be empowered, but also more mindful of their health. So we can work together with them and see what is a reflection of worsening disease and which may be a reflection of more their social circumstances, so they can understand their disease a bit better. Furthermore, I think we can use these outcome measures. The word triaging was mentioned earlier. So for example, if a patient has low pain scores and good quality of life scores with normal kind of blood tests, they're likely doing well. And the meaningfulness of offering them a routine appointment, it might be that they don't need that in their life right now. Perhaps the telephone will do, perhaps deferring the appointment will be better for them. So if this can be communicated with them in a way and they can reach out with their further if they wish, I think it just means that we are able to make it beneficial so we can work together with digital health and in-person encounters, so everything is a bit more meaningful with the patients. So I think your digital charters and your principles highlight a lot of what I'm discussing. The one point that I do want to raise is a lot of digital health resources tend to be quite English heavy. So if there is a way to perhaps incorporate different languages easily, I think that would be amazing and a very good step forward as well, and just generally making it more readable and understandable for a large portion of the population. So thank you.
Wonderful. I mean, really important observations there, and one can sense the sort of practical challenges here actually in trying to get better digital health services and technologies for children. I was struck particularly by the opportunities actually that digital health offers, maybe to understand, listen, and have a chance to hear about the symptoms, the quality of life, and the other issues that maybe haven't traditionally been represented in digital records, for example. But also an important point that I don't think was covered so much within the Charter, but around ensuring the sort of accessibility of digital health information, and particularly language translation, and the sort of the level of digital health literacy as well that we're sometimes assuming within our young adults. I'd like to pass now to Bethan Plant, if I may, for a public health perspective on this. So Bethan, as a lead for the Children and Young People's Public Health team, I wondered what thoughts you had on this.
Thank you, and thank you very much for the opportunity. It was really exciting and positive to receive the Charter, and certainly to see the lived experience and contributions given from young people around how digital innovation can support and enhance young people's experiences of healthcare and public health. I think as a public health professional with an interest in reducing health inequalities and improving health and well-being, I sort of approached reading the Charter with somewhat of a practical lens, looking at it as to how digital technology can support and enhance a young person's experience of healthcare, alongside the practicalities and situations that digital healthcare will be used. For the purpose of the contribution I'm making here today, I was particularly struck with Principle 6, which was focusing on integrating digital health consistently and appropriately with in-person services, and how digital supports and enhances rather than replaces in-person communication with healthcare professionals. Also, how healthcare professionals are trained and supported to use digital healthcare tools, just because I'm conscious from my own experience that young people meet a whole variety of healthcare professionals through different points in their life, and how transferable some of the skills are for using technology for staff. It creates quite a significant training need in some cases. And then latterly, I wanted to just mention about the helping us navigate trustworthy services, because I'm very conscious that in my experience of working with some vulnerable groups, children in care, often their trust of services is somewhat less, and therefore I think there's a real opportunity for how digital technology can support some of those more vulnerable groups. I think I'd just like to finish with just a reflection from my own practical experience, and Samina's I think already mentioned it, around how the tools around digital healthcare use can be more accessible to those with other different community languages, and vulnerable groups who maybe, I've had young people, young adults who share devices, they don't have the device of their own, young people who may feel that we sort of need to galvanise the trust of leaders in communities to encourage young people to access digital healthcare in marginalised groups. And I think for public health, for health protection, it offers a significant opportunity to reach out to young people around healthcare messages such as vaccination, immunisation, screening. But the areas that we need to do that in, the more disadvantaged areas and with different cultural groups, I think there has to be a real opportunity to help support, train, and look at language. And then finally, for those young people that have got special educational needs and disabilities, digital technology gives a great opportunity. It's just about the language and the ability to use it in the best way. But I think it's great, so thank you.
Thank you very much, Beth, and I think drawing attention again really very firmly to the fact that we must be mindful of inequalities and actually whether or not digital health developments are going to be beneficial for all here. And I think that's an important point, and I can see some questions appearing in the chat that actually are raising similar or related points about that. Maybe we'll return to those in the Q&A section after this. I'm going to turn lastly to Chantel Park, who's the Youth Participation Programme Manager at Chilypep. And Chantel, I'd be interested in your reflections. You're clearly involved in this charter process with us, but have a wealth of experience working alongside young people and what you sort of think about the charter and maybe the ways forward in this area.
Yeah, thank you. Hi, everyone. So yeah, it's been great to be involved in the process and seeing some of our older young people being involved in this at sort of every level, and yeah, they've really enjoyed being involved in it. Every step I think comes, is important to youth participation and working with young people in terms of this digital health charter. But I also really wanted to focus on the step 6 around integrating digital health, and that's with a particular focus on the way that we've got things set up in South Yorkshire at the moment and the sort of youth participation and youth voice element to all the work that the young people are doing to improve services and support across the integrated care systems, alongside the Children and Young People's Alliance. We have a group of young people set up that are South Yorkshire champions from every place area. So when we were initially talking about some services in other areas might maybe commissioned differently, or what young people might get in one area is not the same as the other, and them important transitions where they might be moving around. Our whole aim is that we are streamlining those services and being aware of those gaps and really trying to make things better across South Yorkshire for young people to navigate those processes. So I'm looking at it in the terms of integrating it within the work that the young people are doing, and that's also, really championing this charter in areas that we are already working with young people around digital health, and where this might match areas where particular funding comes up through the integrated care services, and that we really work towards every one of those principles. This is a great piece of work that's being done, and we really want to value and use this and feed that into those services where people are really working well to include young people's voices and make those changes. And like a poor example of that is the Growth Accelerator fund that we're currently working on, and that looks at how to make health outcomes better from a regional approach, where South Yorkshire are a pilot of what 3 other areas in South Yorkshire are a pilot of that. So making sure that this charter really adds value and emphasises to the things that we're already working on or that come up through the NHS, the Alliance and integrated care services, alongside the young people, and making sure they're involved at every step.
That's terrific, Chantel. Thank you very much. And again, this sort of emphasis on working with young adults on all of this stuff and the importance of integration there. Thank you so much, panelists, for your reflection. You've given us some food for thought there, as well as pointing towards examples, I think, where things may actually already be happening that are positive. I'm going to turn to some of the Q&A questions that we've got now. First of all, thanks, Gemma. Hayden from Barnsley, you've pointed out both the sort of potential value here of the 2 tech-enabled virtual wards, but also signposted towards a great digital tool there. I'm sure we'll be sort of going to look at that link straight after this if we're not already familiar with the Ready Steady Go tool there. I've got a question from Lucy Neal here, and I wonder if I'll put that towards Kirsten and Angela. Did the young people discuss how they use other apps that positively or negatively impact their health? For example, Deliveroo for ordering high fatty saturated foods, or Fitbit apps, etc., and how they make decisions regarding trust or impact on health.
So in terms of the apps that young people were using within this, a lot of the conversations within the workshops kind of centered around specifically health tools and apps. So the NHS app and other tools that are being specifically used to access healthcare services, as well as tracking apps. And the tracking apps were generally more commercial or publicly available tools and services, including wearable devices and apps that were available on smartphones and things like that. Within this was really then related to individual experiences with them. So especially when it came to tracking was incredibly diverse. For some people, they found tracking tools incredibly helpful for their everyday lives as well as their health management because it helped them kind of keep on top of things. It would send them reminders. It would go on top of this. But at the same time, there were other young adults who it was the complete opposite sometimes, where tracking and especially the use of digital technologies in their lives was something that they were very careful with. And they very much wanted to make sure that that was used in certain ways at certain times. Because of this really came through on the importance in the charter thereby for customization. So people to be able to use it in the way that they wanted to use it. I also saw some comments here around neurodivergence and how that fits into these equations. And I just wanted to flag that if you check out the full charter report, there is some quotations there from some of the participants, specifically around navigating ADHD, and use that in relation to using digital tools and what's helpful and what's not helpful within those spaces. Angela, did you have any reflections on this of kind of discussions that were going around about digital technologies and stuff?
Yeah, there were quite a few conversations about the tracking sort of aspect of it. And some of the young people mentioned sort of like the potential negative effects of that and kind of how it can get sort of obsessive for some of them. Sort of those Fitbit health tracking type apps and get obsessive for some of them. And sort of as far as like sort of the trust goes, I think something that came up a lot was sort of the importance of transparency, kind of with how their data is being used, if it's being shared, kind of what data they're collecting and what they're using it for, and also just transparency around the way the companies operate was something that I noticed came up in terms of, yeah.
Thank you very much, both. I'm just going to head to the next. Hopefully, Lucy, that's given you a good answer to question. I'm not sure if anybody else would like to come in on this point. Thank you. I've got another question from Dave Hembrough. So this is a provocation, Dave. So where are the young adults today? If we're sincere about co-producing and ownership, they should be here helping to present it and getting the opportunity to really have their voices heard. I think it's a fair point, David, although I would point out as well that a lot of what you've seen is actually the result of that very close work, including the animation, which was actually done alongside our young adults from Chilypep. I can see Chantel wants to come in here as well.
Yeah, I just thought it'd be nice to answer that ironically, you know, one of the young people that was involved in it that would have loved to have been here is currently transitioning into university. So it just reflects those key points in the digital health charter. They've just moved from Barnsley to York, I believe. Yeah, they currently moved like literally a couple of days ago. So in the middle of transitioning processes, and again we have to just be more mindful about the time, you know, when we're asking young people to if we want them to come to things like this to present, then maybe we have to be more flexible in our approach to engaging young people in those processes. So as such, it might have to be after university hours, which then makes it sometimes difficult for professionals to come. But we did a lot of that mixed process in the engagement activities that led to creating the charter. So lots of, flexibility between evening sessions, afternoon, online and face-to-face options. And that were to try and engage a diverse group of young people and be flexible around their needs.
Thanks very much, Chantel. I hope, Dave, that gives you a sort of bit of an answer there, but it's good to be provoked and it's good to be sort of kept on the ball with this. I have a question from Chinyeri. So I think there's a couple of points here. So given the rise in young people's mental health and considering neurodivergent group, how does the Charter plan to support developmentally and culturally appropriate and inclusive, safe, ethical and accessible digital health support, especially in mental health services? And what safeguards are in place to protect young people's privacy and data when using digital healthcare tools under this charter? Well, that is a very important question. Now, I wonder if any of the panelists or members of the Hub would like to try and respond to this.
Here you go, and I'll take the difficult question. I'll take one for the team. I'll take one for the team here. So, I think if you look at the charter, it does exactly that. I mean, the charter is about inclusion and about recognizing distinct and relevant groups here. So if you look through all the principles about, if you go through them one by one, you've got recognizing young adults as a distinct group, and that's not necessarily one distinct group. That is distinct groups of young people that will have different needs and we'll need to approach in different ways. You've got that idea of young people as digital learners, and not everybody learns at the same pace. So we need to recognise groups that will learn at different paces and require different styles. You've got tracking development and not just symptoms. So thinking about moving with young people. And again, it's looking at distinct groups of young people and the fluency of young people across the board. In terms of affordability to access, it's about making sure that we have digital tools that are accessible to all young people. And I work in pediatrics, and we think about the same in terms of children as well. About having coordinated support where there is a trusted relationship. So if you look at Principle 6, it's about thinking about that trusted relationship with individuals and with groups. And that, when we look at Principle 7 about training healthcare professionals, we are trained, certainly in pediatrics and child health, to work with diverse groups of children and young people. And I go back to that statement of this charter supports a partnership and not a prescription. It's not about thrusting digital tools on young people and young adults to ensure that they use them. It's about working in partnership with them to see how it facilitates their health and their healthcare. I just wanted to pick up on one other point, which is really about trust. And trust is really important with these tools. And I think that's trust a lot across the board with young people and young adults, which is it's important for young people and young adults to understand who has made the tools, access to information. So who has access to information about their privacy, but also about the information being used appropriately for those that need to use it, and that shared partnership, that there is an understanding of that they consent, that they understand why they're giving information, why those digital tools are being used, and how they will be supported. So it's a very big question to answer, but I think ultimately this is the Young Adults Charter really is about diversity. It's about supporting people from young people and young people and adults from all walks of life to ensure that we meet the needs of as many as possible in the most equitable way possible.
Thank you, Paul. I'm conscious of time. Liam, one very brief response from you, if possible.
Yeah, very brief. I'll just call out, this age group of 18 to 25 is when a lot of mental health manifests for the first time. So I think it's a really good point to bring out, and it's certainly something that the technology sector is kind of awakening to, the mental health implications of technology. We see a lot of collaboration between companies like ours with mental health organizations to try and bring more safety guards into our products. Things like when people are searching for issues around suicide, we try and trigger support pathways and bring resources to the user. and things like that. And I think there's a huge amount more we can do, but it is a big area of activity. So I think it's a really good call out.
Thank you very much. Chinyere, I'm sorry we can't get to your second question, but we have noted it and it's a very important one. But I'd like to now just wrap up, if I may. So thank you all for coming to the webinar today. I'd really like to thank our speakers, our partners, Hopkins Van Mil, AYPH and Chilypep, and of course the young adults who took part in the preparation, the creation and the post-production of this work, and the wider South Yorkshire network who've provided support for us throughout this. So this work was supported through UKRI EPSRC funding, so we're very grateful for that. Please do check out the South Yorkshire Digital Health Hub website. You'll find the full report there, the briefing and supporting materials for the charter. And of course, get in touch with us at any time via email if you've got further questions or suggestions around this work. Thank you for your time today. Hope you have a great day ahead, and thanks again. Goodbye.